Hello there, make yourself comfortable. Today I'm going to be asking you some medical questions before you see your healthcare professional today. So just looking over the previous notes and when you were last seen here, I can see that we did a full assessment including medical questions 2 years ago. Right, so let's start with some general health questions. So, what is your height? Do you know your current weight? 2 kilograms. And how would you describe your general health at the moment? Okay, I'll write all this down. Are you taking any medication at the moment? And what do you take? So, Ramipril and clopidogrel. And what dose are you taking? Okay, do you know what your last blood pressure reading was? And diastolic? Excellent. How would you describe your mental health at the moment? That's very understandable. Okay, how many hours of sleep do you get on average each night? 7 to 8, that's not too bad. Okay, how would you describe your quality of sleep? Is it poor, average, good, or very good? Thank you. And when did you last see your physician? Okay, was that a routine appointment? Okay, I'm just going to run through a few conditions here. Have you ever suffered with or been diagnosed with the following? We have diabetes, hypertension, irritable bowel syndrome, double vision. Okay, I'll come to double vision a little bit later if that's something you've experienced. Amnesia, cancer, headaches, any allergies, anxiety, asthma, angina, Crohn's disease, Sjögren's syndrome, epilepsy, fibromyalgia, gallstones, gout, hepatitis, indigestion, labyrinthitis, lupus, malaria, meningitis, migraines, osteoarthritis, rheumatoid arthritis, psoriasis, shingles, sinusitis, stroke, toothache, underactive thyroid, or vertigo. That's fine, so just the double vision. I'll explore that in a moment. Do you suffer with any of these common fears? Got arachnophobia, aviophobia, claustrophobia, agoraphobia, entomophobia, fear of insects, Okay, that's fairly normal there. Brilliant. So that concludes the general health questions. Okay, let's move on to the next section. Okay, we're moving on to eyes and your ocular health. Now, when was your last eye examination? 3 years ago. Are you having any concerns with your distance or near vision? Okay, so do you wear spectacles? Do you wear contact lenses? Now we're going to move on to the double vision that you say you've experienced in the past. Now, when did you experience this double vision? 2018, around September time. Okay, now, do you know what caused the double vision? Was a cause ever found? Hypertension. Nerve palsy, right? Now, how long did the double vision last? 2 weeks, right? Now, was the double vision vertical? Was it horizontal? Or was it diagonal? Okay, now were you referred to an ophthalmologist for evaluation? Okay, and was there any treatment administered? So that attends to your hypertension immediately, alright? Now, are you still under the care of the eye hospital, or have you been discharged? Discharged, fine. Okay, moving on. Do you notice any floaters in your vision? Any little opacities that move around or shift as you move your eyes? Okay, now they can sometimes be better seen against the white ceiling or a blue sky. Okay, now how long would you say you've had floaters in your vision for? Over 10 years? Would you say the floaters are any worse in terms of are you seeing them more frequently? Any changes in the size or quantity of the floaters? And any flashing lights in your vision? And you said no to migraines. So no visual migraines. Okay, do you suffer with photophobia? Do you have any sensitivity to light that you feel is a little bit more than average? Sunlight or artificial light more so? Natural lighting, right. Do you wear sunglasses to protect your eyes? Okay, let's run through a few ocular conditions. Just let me know if you've ever been diagnosed with or suffer from any of the following. So we have glaucoma, cataracts, uveitis, optic neuritis, orbital cellulitis, papilledema, retinal breaks or tears, retinal detachment, keratitis, which affects the cornea, unexplained loss of vision, whether that was painless or painful. temporal arteritis, macular degeneration, pinguecular, pterygium, central retinal vein occlusion, central retinal artery occlusion, rubeosis, scleritis, episcleritis, conjunctivitis, vitreous detachment, otherwise known as PVD, squamous cell carcinoma of the lids, basal cell carcinoma of the lids, ectropia, entropia, exophthalmos, enophthalmos, any corneal dystrophies, ocular hypertension, meibomian gland dysfunction, trichiasis, hordeolum, chalazion, dry eye syndrome, asteroid hyalosis, that's probably going to be a no, and subconjunctival hemorrhages. Excellent. And are there any eye problems in your family? Mother, father? Any siblings with those? And what about grandparents? Is that maternal or paternal? Excellent, that's the eye section completed. We have one final set of questions. This covers ears and hearing. So, any history of hearing loss? Do others complain you watch TV with the volume too high? Have you ever had your ears checked by an audiologist? I'm going to look into your ears with an otoscope, a little machine where you have to pick up certain sounds with headphones. Does it ring a bell? Okay, do you frequently ask others to repeat themselves? Any ringing or whooshing sounds in your ears? Have you ever had your ears syringed? Any ear-related operations? Eardrum perforations? Pain in the ears? Discharge coming from the ears? Do you have strong sensitivity to everyday loud sounds? Okay, and finally, how sensitive on a scale of 0 to 10, 10 being extremely sensitive, would you say your ears are to loud sounds? 6 to 7. Excellent. Right, so that completes all the medical questions. I want you to have a seat in the waiting area. I'm going to pass all these notes to your medical professional, and they'll call you through very shortly for your physical assessment. Thank you.